Hello and welcome to Back to the Science. I'm Dr. Susan Oliver and I'm a scientist. And this is Julie Oliver. And she's not a scientist, but she is interested in science. So today we are going to be talking about ivermectin, which is actually a medication that is used to treat worms and other parasites in both humans and animals. But ivermectin now seems to have developed a cult following amongst conspiracy theorists, and some people are taking it in an effort to cure COVID. This has unfortunately resulted in multiple calls to poisons information centres and trips to the hospital. And it has also resulted in a shortage of the drug for the people and animals who genuinely need it. Now, ivermectin is a great drug. It has played a huge role in controlling parasitic diseases in developing countries. It's on the WHO list of essential medicines, and its discoverers even received the Nobel Prize. But is any of this a reason to take it for a disease that is caused by a virus and not a parasite? Of course not. So why are people taking it? Well, it all started with people not properly understanding science. So let's go back to the science and look at where it all began. In April 2020, this study was published, which showed that if you infected monkey kidney cells with SARS-CoV-2 and then treated those cells with ivermectin, there was an approximately 5,000-fold reduction in the virus after 48 hours. Sounds impressive, right? Not so fast. Testing in cells is known as in vitro testing, and it's an important first step for screening any potential treatments. And it's a type of research that I do. Alas, less than 1 in 1,000 potential medications that work in vitro end up being successful in clinical trials. And in the case of ivermectin, there was even less reason to think it would be successful. Shortly after the in vitro ivermectin study was published, another paper was published, which cast serious doubt on ivermectin's efficacy against SARS-CoV-2. So here's the paper. And what this study found was that the concentrations achieved in the blood after taking ivermectin at the approved dose were 100-fold less than needed to kill SARS-CoV-2 in vitro. Now, lung concentrations are slightly higher than blood concentrations, but they are still 50-fold less than what is needed to inhibit the virus in vitro. So basically, the concentrations necessary to inhibit the virus aren't achievable at a safe dose. But that's only half the problem. As I've mentioned, the initial in vitro study was done in monkey kidney cells. Now, I'm sure you all know SARS-CoV-2 doesn't typically infect kidney cells. It infects lung or airway cells, and we're not monkeys. Does this really matter? Well, yes. Viruses can only replicate by entering and then taking over the machinery of cells. And how they do this won't necessarily be the same for all cells. As it happens, in July 2020, this very point was proven for another medication popular with conspiracy theorists, namely hydroxychloroquine. So here's the paper, and it was published in Nature, which is one of the highest impact journals around. I'd kill to get a paper published in Nature. So what this paper found was that although hydroxychloroquine and chloroquine were able to inhibit SARS-CoV-2 in monkey kidney cells, they didn't inhibit it in lung cells. And the reason for this was that SARS-CoV-2 is only able to enter monkey kidney cells through one route, and this route is blocked by hydroxychloroquine. However, SARS-CoV-2 can also enter lung cells via a different route, and hydroxychloroquine has no effect on this route. Of course, we now have a number of large-scale randomized trials that have confirmed that hydroxychloroquine doesn't work for COVID. What about ivermectin? Does that work in lung cells? Well, for quite a while we didn't know, but now a study has been done. What did it find? Drum roll. Here's the study. Moxidectin and ivermectin inhibit SARS-CoV-2 replication in Vero E6 cells, but not in human primary airway epithelium cells. Well, the title's a bit of a giveaway, but in case you missed it, no. Ivermectin doesn't stop SARS-CoV-2 replication in lung cells. Now, the Vero cells mentioned in the title are monkey kidney cells, and primary airway epithelium cells are cells directly taken from the lining of human lungs. Moxidectin is like a second-generation ivermectin, which potentially could have worked better than ivermectin, but ended up also not working at all. Now, it's worth mentioning that this paper is still a preprint, which means it hasn't yet been through the peer review process, so the final version may be different. But given the majority of so-called studies of ivermectin are also not peer-reviewed, I think it's worth looking at this paper. So I'm going to mainly focus on the ivermectin arm of the study. What they firstly did was verify that ivermectin was able to inhibit SARS-CoV-2 in monkey kidney cells, and the concentration necessary was similar to that found in the original study. They then repeated the experiments in both lab-grown lung cells and cells taken directly from the lungs of patients. And what they found was that ivermectin had no effect whatsoever. And this was the same even if the concentration was doubled. And the other thing they did was they also tried treating SARS-CoV-2 outside of cells to see if maybe, the ivermectin might work that way. And again, it had no effect. So what this means is that there is absolutely no in vitro evidence that ivermectin works in COVID. So does this mean that ivermectin definitely doesn't work for COVID? No, it is possible that it could work by some other mechanism that is not directly related to its action on the virus or lung cells, but the same could be said for every other drug on the market. There's nothing special about ivermectin. So what about all these people claiming that they took ivermectin and they got better? How can that be happening if ivermectin doesn't work? Basically, although COVID is a very serious and sometimes deadly disease for a lot of people, the majority of people who get COVID do get better. So it's not surprising that some people get better after taking ivermectin because they were going to get better anyway. And of course, people who take ivermectin and then die from COVID can't talk about it because sadly they are dead. So how can we determine if ivermectin is effective against COVID? The only way is to perform what is known as a randomized controlled trial. What happens in a randomized controlled trial is people are randomly assigned to one of two groups. One group is given the treatment and the other group is given a tablet that looks identical to the treatment but doesn't actually contain any medication, otherwise known as a placebo. You then compare the results of the two groups and see if there is any difference. As it happens, some of these trials have been done, and the results have been gone over with a fine-tooth comb by the Cochrane library to produce what is known as a systematic review. And Cochrane is the gold standard for these types of reviews. What did they find? Let's have a look. The complete report is 159 pages long, so we'll just have a look at the author's conclusions. Let's just find them. So I've highlighted the relevant section, but I'll read it out just in case you're watching on a small screen. Based on the current very low to low certainty evidence, we are uncertain about the efficacy and safety of ivermectin used to treat or prevent COVID-19. The completed studies are small and few are considered high quality. Several studies are underway that may produce clearer answers in review updates. Overall, the reliable evidence available does not support the use of ivermectin for treatment or prevention of COVID-19 outside of well-designed randomised trials. So basically, there is no evidence at the moment that it works, but trials are continuing. Now, since this review was published, two large trials have also reported results. So let's take a quick look at them. So here's the first trial. It involved 501 patients, which is a pretty large number of patients. So what did they find? So there was no significant difference in the need for hospitalisation between patients taking ivermectin and patients taking placebo. They also found no significant difference in any of the secondary outcomes, and that included the death rate. What they did find, however, was that patients who required ventilation required it sooner if they took ivermectin, which suggests that ivermectin could be causing harm. This hasn't been seen in any other trials, though, so it could just be an anomaly. So let's have a look at the other trial, shall we? This trial is even larger. It involved 1,355 patients with COVID. It was part of a large trial known as the Together trial, which was designed to assess various existing drugs for potential use in treating COVID. This hasn't been published yet as a paper, but the results were presented at a scientific conference. And what they found was that ivermectin had no significant effect on hospitalisation or death from COVID. So things aren't looking good for ivermectin. Now, it's possible that future large trials using different doses or in different patient groups might show a benefit, but I wouldn't be holding my breath. Now, if any ivermectin proponents have found this video, they will no doubt be shouting at the screen and hammering on the keyboard about the meta-analyses and reviews that they saw in low-quality journals or on dodgy websites. So what's going on there? Well, in a nutshell, reviews are only as good as the studies that are included. So if you include a lot of rubbish studies in your review, you will end up with a rubbish review. As they say, garbage in, garbage out. But if you would like a more detailed explanation, Julie and I are working on a video to address just this question. So please hit the subscribe button if you would like to see it. We will also be making videos addressing various myths that are shared on social media and taking you back to the science. So if there are any myths that you would like us to look at, please ask in the comments. Thank you for listening, and please stay safe, everyone.